Welcome Iowa Autism Learning Community. Today's webinar, titled Using Functional Communication Training to Treat Challenging Behavior, is brought to you by the University of Iowa Division of Child and Community Health, Child Health Specialty Clinics in the Regional Autism Assistance Program. My name's Rochelle Swanson-Holm, and I am the organizer and moderator of today's session. The session will be recorded, and the link to that recording will be provided in a follow-up email. Questions will be answered following the presentation, so be sure to type your questions into the question box throughout the presentation. CME and CE credit will be available for those attending the live session, and instructions to obtain those credits are in the handout section in the control box. Again, welcome, and I'm excited to introduce our presenter today. Matthew O'Brien is a board-certified behavior analyst and is a clinical assistant professor of pediatrics at the University of Iowa Stead Family Children's Hospital. He completed his doctorate in psychological and quantitative foundations from the University of Iowa and completed postdoctoral fellowships in neuropsychology and behavioral psychology at the University of Iowa Hospitals and Clinics. Dr. O'Brien serves as a Director of Biobehavioral Services and Director of Research and Psychology for the Iowa LEND program. He is also the Principal Investigator on multiple R01 research grant funded by the National Health Institute, evaluating behavioral assessment through telehealth, and he also conducts research related to functional analysis of severe and challenging behavior in individuals with autism and other neurodevelopmental disorders. So Matt, welcome and thank you for being our speaker today.
All right, thanks so much, Rochelle. I don't know if this is left to me, but there are no conflicts of interest or relationships with commercial entities to report. So I'm going to jump right in, and I set my timer for 50 minutes because I do want to leave time for questions. So if we get to close to the end and I need to skip some slides, I'll do that just to make sure we have time for questions. All right, so once again, thank you for the opportunity to talk about an approach to treating challenging behavior that I've come to believe is probably the most powerful and acceptable treatment developed for this issue. And it's something that I've been using now for more than 16 years in both research and clinical care. Let me briefly go over the learning objectives for this talk. I'm hoping that you all will better understand how challenging behavior is learned and serves as a communication tool. I'm also hopeful that you'll learn the steps involved in developing and implementing functional communication training. And finally, I hope that you'll take something away from the brief overview of the research to support FCT that I'm going to talk about. And I do want to mention before I get too far into this talk that you're probably going to hear me refer to children often during this talk. And that's just out of habit because I do see a lot of children in both my research and clinical work. However, I want you to be aware that this talk really relates to persons of all ages and really across many different disabilities, so not just autism. Before we talk about FCT, it's really important that we first discuss how challenging behavior initially develops, and then once it develops, why it continues to occur. Something that I want you to all take away from this talk is that behavior is learned, and the teacher is the environment. And I'm going to introduce you to what is called the operant learning model, which is the basis for understanding how and why behavior occurs based on the influences of our environment. It all starts with the behavior, and the cool thing about this model is that it applies to all behavior. In other words, this model doesn't just apply to problem behavior, it also applies to adaptive or prosocial behavior, like when someone approaches another person to say hello. And like I said, it also applies to challenging behaviors, like when someone approaches another person and instead of saying hello, socks that person in the face. So even though we're going to focus on challenging behavior, this model really can explain all human behavior. So a behavior occurs, but unless it's the first time that behavior occurs, it's really not random. There are internal and external signals that exert control over that behavior. We call these signals antecedents, or sometimes people call them triggers. And antecedents are just these events that occur in the environment before a particular behavior is emitted or occurs. And an antecedent is what evokes or brings on a behavior. However, what determines or what happens after the behavior, what we call the consequence, will determine whether that behavior is more or less likely to occur again in the future. The consequence or the events that follow a behavior can be beneficial or rewarding. They can be absent of any rewards, or they can be aversive or what we call punishing. Every time a rewarding consequence occurs following a behavior, it strengthens this reward circuit and increases the likelihood of that behavior occurring again in the future. Every time an aversive outcome follows the behavior, it weakens this circuit and makes it less likely that the behavior is going to occur again in the future. So let me give you an example. Let's say that Johnny really loves his iPad, which I think is probably applicable to every kid in this universe. But Johnny's been playing on it for a long time, so his mother takes his iPad and tells him it's time to be done. Johnny becomes upset and he begins to hit himself in the head repeatedly. Johnny's mother, like most good, loving parents, doesn't want him to hurt himself, so she relents and she gives him back his iPad in an attempt to calm him down. Now, I realize that most parents, teachers, and therapists wouldn't take this route and give a child something they wanted just because they were disruptive. But even if it happens every once in a while, by returning the iPad following this episode of head hitting, the reinforcement circuit is strengthened and it makes it more likely that that behavior is going to occur again in the future in that situation. Now, most parents and teachers with a child with challenging behavior can tell you that some days are better than others. People are variable and challenging behavior may not be highly predictable or reliable for some children. One day a child may blow up when the iPad's restricted, and the next day there may be no challenging behavior for that exact same situation. In some cases, it may point to other influences on behavior that we call setting events. Setting events are these things like hunger, sleep, medication, pain, and mental health issues, sadness, depression, things like that. And these things don't cause the challenging behavior, but they can raise or lower someone's threshold for behavior. For example, I'm much more likely to honk at another car that cuts me off when I'm tired, hungry, feeling sick, or maybe just feeling irritable overall than if I'm feeling great. Probably going to let that car go by. So challenging behavior is learned, but because it's a tool that's learned, there is hope for developing more appropriate tools to adapt to these situations we don't like, these aversive environments that our kids may show disruptive behavior in. While behavior develops through the learning process that I just described, the operant learning model, the reason that behavior continues to occur is because it's both meaningful and it's communicative. This cartoon gives an example of this. And in this cartoon, Lucy says to Linus, "Let's see now, how can I put this into words? What I mean is, what I want to say is, how can I put into words what I'm trying to say is, pow," she punches him in the face, punched him right in the nose. And he says, "Rats, I was hoping she could put it into words." Lucy's behavior has a message to it. Linus may not understand what that message is in this situation, but there is a message. So if challenging behavior is communication and we find a way to reduce it or suppress it, then what we're essentially doing is we're taking away someone's voice. We're taking away that child's voice. Fortunately, we can give those individuals who show challenging behavior a more appropriate way to communicate through a treatment called functional communication training, or FCT. This picture is Dave Wacker. He was my mentor going through grad school, continues to be my mentor, and he's one of the earliest and most prominent researchers on training kids to communicate using FCT. In fact, the picture on the left is one of the books he's written on FCT, and it's a really great resource for parents and professionals interested in learning a little bit more about FCT. Let's get into the nuts and bolts of FCT. So what is FCT? FCT involves a fairly straightforward three-step process. The crucial first step, and this is really crucial, is to identify the function or the message that the individual's challenging behavior is sending. Oops. And there's really multiple different messages that a child can send. But in this first step, we want to ask, what is your child saying in this situation? So like I said, there's many different things that a child's problem behavior could be communicating. But two of the most common are, I want something and I don't want to do that. So when I say I want something, I'm talking about a child wanting something like electronics. I mentioned the iPad earlier, food or snacks, or maybe even parent or sibling attention. And then there's also, oh, by the way, this message is oftentimes sent when something's restricted or something's taken away. So if we take away the electronics, or if we say no to a preferred snack, that's when this message is oftentimes produced. The second message is I don't want to do that. For example, I don't want to do schoolwork. I don't want to do chores. I don't want to go to the doctor's appointment. I don't want to go to bed. Or in some cases, I don't want to go into this busy environment. It's too loud, too overstimulating. So these two messages are a bit of a push and pull, where one message is to get something and another message is to get away from something. And sometimes determining the function or message of challenging behavior can be really simple. For example, if you have to take your child's iPad away and the child immediately displays disruptive behavior, it's pretty likely that your child's message is, I want the iPad back. However, there are many children we see in our clinics where the message is not super clear. And so we have to evaluate the function or the message of the challenging behavior through a test we call a functional analysis. I'm not going to get into all the details, but this test we often describe as like a behavioral allergy test, because we're going to pick, poke, and prod and see what situations bring on the behavior. What are the flare-ups? What causes those flare-ups? So once we understand the message or the messages for a child's challenging behavior, we need to determine what the best communication option may be to replace the challenging behavior. I have yet to find an individual who could not communicate using a more appropriate method than the challenging behavior, but it's important that we find the best option for them. Appropriate communication comes in many different forms. For some individuals, they can generate their own verbal behavior, while for other individuals, they require a device. So I'm going to take you through a few different options, then I'll talk a little bit about the benefits and limitations to each of the modalities. To begin with, vocal communication is the most preferred. Believe it or not, even for kids who are highly vocal verbal, meaning that they can essentially say anything or talk your ear off, FCT is still helpful because it gives them effective communication that requires them to use that communication at the right timing. So some of these kids can say what they want or say what they need, but they just don't always have the right timing. And many of the highly verbal kids we see struggle to use their vocal communication when they're upset. So it just doesn't come out at those times. Next, we have manual sign. Many children learn some of the basic signs like please or more when they're really young. And so long as you have an audience that understands sign language, it can be really beneficial in FCT. For device-generated options, we have different levels of technology. At the low end, we have picture cards, which many of you may be familiar with. We oftentimes use cards that are created with Boardmaker. Sometimes they're used within a PECS communication system. We also oftentimes recommend more realistic pictures than what Boardmaker produces, because if an individual cannot read the text on the card, the picture may not be the most accurate representation of what the card means. We also have mid-tech options, like this Big Mac switch that you see right there, the big red button there. And these mid-tech options often have some type of voice output when you press or activate it. Switches like the Big Mac switch in this picture allow you to record any message that you want to communicate, but generally it's only one message at a time. We oftentimes pair picture cards with a Big Mac switch, or with the switches that we use, by velcroing the picture to the top of it, so that there's a visual representation of what the individual is communicating for. And then finally, we have high-tech options. These are devices, often on a tablet, that have icons or grids that you can press, which produce voice output. Like any other tablet, these devices often have like folders where the icons are grouped or sorted, and then require the individual to navigate to find what they want to communicate for. Some individuals may benefit from more than one option at one time. For example, an individual may be able to vocally communicate for snack, for preferred food, but may struggle to vocally communicate for help, which we may then utilize like a picture card to communicate for. However, we really do discourage using lots of different communication options unless needed. In many of the cases, particularly when using a device-generated communication option, we use a model where we progress from the most basic form, like a picture card, to a more mid or high-tech option once the low-tech option is mastered. Determining which of the options to use requires a cost-benefit analysis. So here are some of the variables that you should consider when considering the different options. The first is cost, and as you can see, each of these options varies in terms of zero or low cost. Vocal communication costs nothing, manual signs cost nothing, Low tech, there's some costs associated with creating cards, whereas high-tech options can be thousands of dollars. We've seen kids with communication devices that cost upwards of $5,000 or $6,000. So there is a huge, variability in the cost of these options. The second thing to consider is portability. The most portable communication options obviously are vocal and communication and manual signs. It doesn't take anything to carry those along with you. Whereas with low tech, you've got to carry pictures, and sometimes it's multiple pictures, and sometimes you have kids carrying picture books, so that actually can be quite difficult to carry around. The mid-tech options also can be kind of difficult. Carrying this switch around or multiple switches can be a little bit challenging. High-tech's generally lower portability. Lots of people carry around tablets or iPads these days, but sometimes they can get heavy and can also make it a little bit difficult for kids to carry around. The audience is huge. Obviously, vocal communication has the largest audience. Most people understand language, vocal language. Manual sign has a fairly small audience. Even in our clinic, when we see kids with who use a lot of sign language, we have to go in and determine what the different signs are for the things we're asking them to communicate for. There isn't a huge audience for that. The device-generated options generally are understood because they either have a picture that others understand, or there's some kind of voice output that indicates what the individual's communicating for. As far as ease or effort involved, this is relative. When you think about the tech options, they can be as simple as touching a card or a switch, but then we do see kids who have lots and lots of icons on their devices that takes lots and lots of effort to navigate and learn just how to find the things that they want to communicate for. In all cases, we like to start with the most simplistic form of communication and then move up to more complex systems over time. And then the prerequisite skills. There are some children who probably will never be vocal verbal communicators. When we see kids who are 10, 12, 15 years of age and haven't begun using or don't use vocal verbal communication or only have a few words, it's pretty unlikely that we're going to focus on vocal verbal communication for those individuals. The easiest things tend to be things like touching a picture card or touching a micro switch. Ultimately, though, the most important variable may be the child's preference. We have a lot of research data that suggests children learn their communication strategy faster and persist much longer when their communication strategy is something that they prefer over other options. So we oftentimes recommend doing preference assessments for these different options. All right, so once we've determined the message or the messages your child's behavior is sending, and we've identified the best communication option, the final step is to implement FCT regularly. This is really all about practice. FCT involves teaching an individual to use that communication option that we've identified for the same purposes or functions that he or she uses challenging behavior for. And this involves two behavioral principles. The first is reinforcement. We're reinforcing the use of an appropriate communication option, and the other is extinction. We're extinguishing or withholding reinforcement for the challenging behavior. I'll give you a visual of that next. So here are the specific procedures involved in FCT. Here's our ABC model. Remember, we talked about the antecedents, the behaviors, and the consequences. Let's start with baseline. Let's say that a child named Johnny loves his iPad with Roblox on it. He loves to play Roblox. And when we take away that item, we tell Johnny it's time to put that up, Johnny engages in self-injury. He hits himself in the head and he cries. And let's say that every once in a while, when Johnny does that, we give it back to him because we want him to calm down. We don't want him to be upset. Remember, that's that reinforcement circuit, that strengthening of that challenge behavior. So every time we do that, it strengthens that head hitting and crying. In treatment, we may start off the same way where we restrict that preferred item, but we're also simultaneously offering that communication option. Here you've got a Big Mac switch with a picture card on it where the child can just touch it and it might say something like, "Toys, please." If Johnny does hit his head and cries after we restrict, we don't give him back the Roblox. We withhold that. We make sure that he doesn't get what he wants for that problem behavior. However, if Johnny does touch that Big Mac switch, we want to honor that. We want to show Johnny this is the way you can get what you want. And so we essentially reinforce the communication and put on extinction the problem behavior. When Johnny's challenging behavior functions to escape or avoid tasks, the model will look a little bit different. We might start off with some kind of task where, like folding laundry, and Johnny goes to, say, self-injury and crying because he doesn't want to do it. Every once in a while, Johnny may get a break from doing that. A parent or a teacher or a therapist may say, hey, Johnny, just take a break. We don't want you to hit yourself. And by doing that, we're strengthening that behavior. So what treatment's going to do, we're also going to give Johnny the task and an option to communicate. If Johnny hits himself or cries, there is no break. However, if Johnny touches the switch that says something like break, please, he's going to get that break. So we're differentially reinforcing communication. We're giving him the option to communicate instead of using challenging behavior. Once your child has learned to communicate for the things he or she wants to do, we move on to step 2. And you might be asking yourself, do I always have to give my child everything that they request? And the obvious answer to that is no. We all need to learn to wait for things, and we all need to learn to accept when we cannot have something we want, which we'll get to in just a minute. So the second step is to teach tolerance for these delays. Once again, only after your child is communicating reliably and challenging behavior is relatively low, we start to work on these delays. Here are the steps for teaching tolerance for delays. Okay, so we begin by restricting a preferred item or activity, just like we did before, and we simultaneously set a timer, or we identify some kind of task. It could be a work task or a leisure task for the child to complete. Once the timer sounds, indicating that the delay is over, or once the child completes the task that we've offered them, the child can then request the preferred item or activity, and we're going to honor that. Once again, let me give you a visual. Just as before, the first step is to restrict the preferred item or activity. Then you have 2 options. The first is to give the child, set a timer and give the child some preferred items, or it doesn't even have to be preferred items or activities that serve as something to keep that child engaged. Once that timer sounds, we provide the child the opportunity to communicate, and if they do, they get their preferred item back again. The other option, as I mentioned, is to provide some kind of task. So we restrict the item, the preferred item, we give the child some kind of task to do. It could be completing a puzzle. It could be doing a work task. It just depends on what we're trying to work on. And once that child completes that task, we provide the opportunity to communicate again. And the child communicates, they get what they want. In both cases, whether you use a time-based or task-based, challenging behavior is not going to result in the preferred item. In other words, if any challenging behavior occurs, we're just not going to give them the the tablet with Roblox back. The goal should be to slowly increase the amount of delay that we use for children so that they're tolerating longer and longer periods of delays. For some kids, we start as short as a 5-second delay, or even just doing one puzzle piece. But over time, we need to slowly increase the amount of time or the amount of tasks that they do in something that we call demand fading or time fading. If you're using a time-based approach, you simply increase the amount of time slowly. But if you're using a task-based approach, you might increase the amount of the task, or you might increase the number of tasks that the child's doing after each successful trial. Okay, so we've built up a child's ability to communicate for what the child wants, and we've taught the child to wait for those things as well. But there's one final step that we like to take in this treatment sequence that's really to help a child learn to tolerate unplanned denials of their requests. Because while we want to honor our child's communication as often as possible, there are times where we simply cannot. For example, if you go to McDonald's with your child and your child asks for a taco, they aren't getting a taco. Or if your child asks for the iPad or wants to plan the iPad, but the battery's dead, we can't honor that. So we work on delaying denial, and learning to tolerate restriction comes down to a few difficult steps. Just like with the delays, it starts with restricting a preferred item or activity, but in this case, we're informing the child that the item or activity is done or it's off limits. We need to make that clear. If or when the child communicates, we're going to do 3 things nearly simultaneously. First, we want to praise the child for an appropriate request because we still value that request over disruptive behavior. We want to give them something back for that request. But we're also going to offer another item or activity. This shouldn't be a substitute. So if we take the tablet, we don't give them a phone as a substitute. We want to give them something else to engage with, something that, and it can be preferred, just not that same thing that they requested. And then we're also going to remind the child that the requested item is still off limits or done. We want to keep that kind of restriction salient. We want them to know that they just can't have it. So here's a visual of this procedure. As I mentioned, we restrict the preferred item to start with, just like before, and then the child has the opportunity to communicate. And if the child does not communicate and tolerates the restriction, once again, praise them for that. We want them to be able to tolerate the restriction, and they don't have to want it back. They don't have to communicate for it back for us to praise them. However, if the child does communicate, once again, we're praising them for communication. And then we're reminding them of the restriction, and then we're offering them other items or activities. There are a lot of ways to augment this, and I won't go into a lot of details about it, but essentially we can teach children to pay attention to the signals that will indicate whether or not the requests are likely to be honored or not. Particular signals like a parent who's busy folding laundry can be used to indicate that the probability of the child's request being honored is low. Whereas if a parent's sitting with nothing in front of them, that might serve as a signal that their request is going to be honored. Okay, so I've shown you some of the nuts and bolts to conducting functional communication training, but I also want to talk about the research on FCT. FCT is likely the most studied function-based behavioral treatment approach ever. In fact, in a recent study by Gamagami and colleagues, they found that there were more than 200 published studies using functional communication training. Within those studies, there were more than 744 demonstrations of FCT for 640 participants. And the reason why there were way more applications than there were participants is because the participants sometimes received functional communication training for more than one behavior or more than one function. And that's something I didn't mention earlier, but sometimes we use functional communication training to address one message, but then we need to go back and use it for another message as well, or for a different behavior we've identified. Those demonstrations that were included in that review included children and adults with and without many different disabilities, not just autism, not just children, across the dozens of different challenging behaviors, and with a large variety of therapists that included teachers, paraprofessionals, behavior therapists, and maybe most importantly, many applications of FCT were made by parents of the children with challenging behaviors. And ultimately, at least our philosophy in our clinics, is that those are the people that are most likely going to be working with their child with communication. So we want them to be the therapist in FCT. In fact, we train the parents to be the therapist. Across those 740 applications, 90% of the participants showed a reduction of challenging behavior by 80% or more from baseline. So the vast majority showed substantial reductions in challenging behavior. 80% is a pretty high percentage, but when 90% or more are showing that type of percentage, that shows you it's a really powerful treatment. Those are large treatment effects. Many of you have probably heard the terms evidence-based or scientifically validated treatments. These terms are often used to indicate that a treatment is reliably effective for the purposes that it was developed for, meaning it's effective and it's effective as it was designed. The two largest reviews of non-pharmacological treatments for autism, the National Autism Center's National Standards Project and the National Professional Development Center for Autism Spectrum Disorders Review of Evidence-Based Practices for Individuals with ASD, the mouthful, reviewed hundreds of treatments for individuals with autism, and both of these reviews identified FCT as an evidence-based approach. And you'll see it listed as evidence-based in many other publications, but these were kind of official labels placed based on these big reviews. And I'm not sure how many of you are familiar with FCT, but if you are, you've probably seen Iowa pop up on some of the publications you've read, if you've read some publications on FCT, because some of the most cited research on FCT has actually come out of here, the University of Iowa. And just last year, our research team, led by Drs. David Wacker and Scott Lindgren, published the first randomized controlled trial of functional communication training. Randomized controlled trials are the gold standard of research evidence. We conducted this study via telehealth with young children with ASD who exhibited challenging behavior. And as I mentioned, our philosophy is for the parents to serve as therapists. And in this case, the parents served as therapists for all assessment and treatment sessions with coaching from our behavior analysts remotely. This figure shows the results from the study, and I'll walk you through it quickly. So for 56 children and their parents, we randomized them to either an immediate treatment group, which is shown in the blue data path here, or a delayed treatment group, which is shown with the red data path. On this y-axis, going up and down on this, this figure, you have the average percentage of session intervals with problem behavior, which essentially means that the higher a data point is on this axis, the more problem behavior the children showed. And then, remember, this is an average. On the x-axis, here down on the bottom, the horizontal axis, you have the 4 times that data were compared. The first comparison occurred at baseline, as you can see, these two groups had similar levels of problem behavior at baseline. What that means is that they showed the same amount of problem behavior to start with, so they were the same types of groups. They were, in addition to being all kids with autism and all young kids, their behaviors in terms of the percentage of behavior was about the same. For the next 3 months after baseline, though, the immediate treatment group received that functional communication training, while the delayed group waited for treatment, but continued to participate in any other therapies that they may have already been enrolled with prior to the study. When those 3 months were up, we compared challenging behavior again. And for those in the immediate treatment group, the ones that had received functional communication training for 3 months, the rates of challenging behavior was near 0. While the delayed group, who had not yet received FCT, their challenging behavior was essentially unchanged from the baseline levels. The delayed group was then offered treatment, so they all then received treatment, the same type of FCT treatment that the immediate group had. And after another 3 months, challenging behavior was substantially decreased for that group as well. So both groups showed substantial reductions in challenging behavior with FCT. Finally, we compared the gains that both groups had made during treatment and whether or not they maintained 6 months after treatment ended. And as you can see in this last data point, both groups showed that they maintained their successful treatment outcomes 6 months after they had ended treatment. The conclusion we came to in this paper, and I'll just kind of read directly from the paper, was that what we showed was that for children with ASD and severe behavior problems, parent-implemented FCT significantly reduced problem behavior, while ongoing interventions typically did not. Okay, so FCT is effective, but even when a treatment is highly effective, there's no guarantee that the potential recipients will want to use it. So many researchers in our field have made it a point to evaluate the social validity or the acceptability of the treatments we're researching and using clinically. And this is really important. We want our treatments to be effective, but we also want our treatments to be something that people are willing to use, and when they do use it, that they find it acceptable. With regards to FCT, in the review that I mentioned earlier by Gamagami, they collected data on studies that evaluated social validity. And of those 744 applications of FCT, there were measures of social validity on more than 190 of them. And what they found was that more than 97% of those social validity measures excuse me, indicated that functional communication training was either satisfactory or highly acceptable. And remember, 97% is a greater percentage than the percentage who improved by 80% or more. So even if a family or an individual did not improve by 80% or more, a good chunk of those were still finding functional communication training to be acceptable or satisfactory. What's really impressive is that the measures of social validity were higher for all these different groups that were surveyed. And this included group home staff, teachers, parents, and most importantly, there were many individuals who actually received FCT themselves, both children and adults, who were able to express their satisfaction with the approach. In fact, one study was really interesting where they gave a child different approaches, different treatments that they had learned, and they gave them the option to choose any of these different treatments or to choose none at all, and the children were choosing functional communication training as the approach that they wanted to use. So just to add to that review, in our own research, we always evaluate the parent acceptability of FCT treatment. And in one of our publications, we showed that for 94 parents who implemented FCT, the average rating on our measure of social validity, which is called the TARF, was very acceptable. We use a scale that goes from 1 to 7, with 7 being very acceptable, 1 being not acceptable at all. And the lowest score we had on that measure was a 4. So not even one parent, which means a neutral view. So out of those 94, not even one parent out of those 94 viewed FCT as negative or viewed FCT negatively. All right. I am flying through this, so I think we're going to have plenty of time for questions. I did really pack a lot in here, and I'm happy to go back to some of those previous slides or give some more details on things that I mentioned earlier. But there are a few themes that I wanted to make sure came through in the slides and in my talk. First, remember that challenging behavior is influenced by the environment and it's learned. It's not, if you're a parent on here, a teacher, a provider, it's not your fault that a child has challenging behavior. But I also want you to know it's not the child's fault either, because the second theme that I hope came through is that challenging behavior is meaningful. And for most children, it's the best way that they know how to communicate their wants and needs. They've essentially learned that this is the best way to do it because other forms of communication are hard. Or maybe they didn't have access to those other forms of communications. Thirdly, I've yet to meet a child who did not respond to functional communication training. Every child can communicate more appropriately. And you really can't convince me that for any child that can reach over and hit their parent or can reach up and hit themselves in the face, that child cannot touch a picture card or press a Big Mac switch to let you know what he or she wants. FCT is really about giving the individuals a voice and really about giving them more autonomy, the ability to be independent. Finally, I hope that the research that I showed you was compelling. I know I didn't go through all the different studies and really hit mostly the reviews and some of our research, but I hope it was compelling and convincing because FCT is not only a really powerful and a really effective treatment, it's acceptable. It's both acceptable, or it's acceptable to parents, therapists, teachers, and most importantly, it's acceptable to those who are receiving the treatment. So I've flown through those slides. I do have plenty of time to answer questions. So maybe, Rochelle, if that's okay with you, I'm happy to jump in and answer any questions.
Sure. So I just want to encourage everybody to go ahead and, if you have a question, to go ahead and put it in the question box. And I'll give you a few minutes to do that. Right now, we don't have any questions, Matt, but I did want to thank Matt for an excellent presentation. And I'm a visual learner, so the visuals really helped me get a better understanding of FCT. I've seen other presentations on FCT, and so like I said, the visuals really helped me. So I appreciate that very much in the examples. Yeah, so we're just gonna wait a few minutes here and see if we get any questions in the question box.
And one of the things, Rochelle, just kind of on that topic or that note, as a therapist or as a behavioral therapist, when we work with parents, we do a lot of modeling of these approaches. Ultimately, if the parents are going to be the therapists with their child at home, we want them to learn these procedures. And so, I showed you these visuals here. For those interested in FCT and learning to do FCT, get with a therapist who can really show you how this works. It's a very straightforward approach, but it's not simple. And what I mean by that is lots of decisions to be made. We have to determine why the child shows the behavior in the first place. We have to determine what the best communication options are. And then we also have to teach parents how to set up practice sessions and how to do this on a regular basis, because that's ultimately what's the kid's going to take away is the repeated practice. It's not going to be a one-time or one trial thing.
We do have a request. If you would go through an example of real world implementation one more time.
Yeah, absolutely. So I could certainly go back to the visuals, but maybe I'll just kind of describe it first. So I should mention, when we talk about functional communication training, I want you to think about it as just as you would with teaching a child to read, right? The goal is for the child to read out in the natural environment. We want them to be able to read a menu or to read a sign, a street sign. But we don't necessarily go out and just do that. We don't just focus on the street signs and the menus. We actually have to sit at home and practice this reading approach with them. We have to give them lots of practice and trials so that they can do that. So when we talk about doing FCT, we're really talking about two things. One is setting up structured practice sessions where we repeat these kind of approaches over and over again. And then we're talking about the generalization aspect, where we take the kind of strategies that we're learning in FCT and we use them outside of the home, outside of the context that we're practicing them in. So, for example, let's say that we have a child who engages in destructive behavior in order to get their parents' attention. At home, we may set up some scenarios where the parent is playing with the child and the parent says, hey, I'm going to be busy for a little bit. If you want me to play with you, if you want my attention, you can touch this card or you can press this switch. Or if it's a vocal verbal kid, you can say, play with me. And sometimes we give them the specific words. We go ahead and restrict our attention, turn our back. Now, if the child, remember, if the child shows problem behavior, we're not going to give them that attention back. We just can't do that. We can't allow them to make those connections. But if they do use that communication option that we've taught them to use, or that we're working with them on, we're going to give them that attention, high quality attention, praise, and we're going to keep doing that over and over again. Now, when we get out in environments, whether it's, and it doesn't even have to be outside of the home, it could be inside the home. We come home at the end of the day and maybe I've got some laundry to fold, or maybe I've got some dishes to do. I want to be able to have those communication options out there for my child. And initially, before we work on delays and denial, we're going to honor those communication opportunities whenever they come up. So I'm doing dishes, my child says, he pushes the switch that says play with me. I want to run over there and play with my child as much as I can early on. Now remember, when we work on these delays, we will help them. We'll develop some strategies. I'm washing dishes and the kid presses the switch that says come play with me, and I say, oh, here's a puzzle. I want you to work on this while I'm doing dishes, and once you're done, then you can ask me. And then, of course, there are going to be those times where we absolutely have to do the complete denial. We have to say we just can't give you that attention. But after we've worked on this for a long period of time, it's going to be much more tolerable for the child to take that than if we just do that out of the blue without having practiced this communication approach. So in terms of real world strategies, it's practicing within these structured practice sessions. We oftentimes tell kids or parents to block off 20 minutes, 30 minutes, 40 minutes a day if you can do it, and just work on repeated trials of this. The child communicates for your attention, you give it to them for a couple of minutes, and then you set it up again. Hey, I'm going to be busy. Let me know if you want me to play. And you do it over and over and over again. But then outside of those structured practice sessions, we're giving the child the opportunity to use those communication strategies as much as possible in more of the natural situations. I hope that answered the question or made sense, but once again, it's a combination of practicing and structured practice and real world applications.
Okay, I thank you for doing that, and I have some questions. So, sure. One disadvantage of FCT is that it may result in the development of undesired behavior chain. Can you elaborate on how it can be avoided?
So, as I'm reading that, I guess one thing that pops to mind, if this is what they're referring to, is the idea that we practice this approach and we do it in such a structured way where these links in this chain seem to have to occur all the time. In other words, I have to tell the child I'm busy, I have to set out a micro switch, the child has to touch the switch, they communicate and they get that. And then sometimes, if that's what this person's referring to, sometimes that does become this chain that is almost, it's almost unnatural, unspontaneous. And so the best way to not have these chains occur is to train kind of loosely. It's to not always do it in that exact same way every single time. Oftentimes when we get to delays, for example, we may want to occasionally reinforce immediately when the child requests rather than do the delay. So if we're working on delays, it's okay to occasionally toss in a, oh, good job asking, I'll play with you right now. When we get to restrictions, same thing. We don't want to spend 20 or 40 minutes of telling the child no. Occasionally we reinforce it, occasionally we do not, because over time it does become a little more rigid. It does develop some chains. We also have to be really careful that if a child shows disruptive behavior, we're not now prompting them to communicate instead, and now developing a chain whereby every time the child wants to communicate, they first have to show problem behavior. In other words, if I'm playing with the child, I say I'm going to be busy, the child shows disruptive behavior, and I say, touch your switch, and I'll play with you. Some kids will learn, they're savvy, they pick up on it, they'll learn that, oh, I have to be disruptive first, then you're going to tell me to do it, then I'll do it, then I'll get your attention. So that's another chain that we got to be really careful about, and the way to break that chain is simply avoiding the prompting when problem behavior occurs, so that it doesn't become associated with that. So the child doesn't see the opportunity, only comes after first showing problem behavior.
Great, I hope that answered the question. So we have a similar, I think, question. Can spikes of problem behavior be expected when starting to implement FCT?
Yeah, that's a great question, and it's something that we talk about often in our research because, and actually in our clinical world too, because initially we're asking the child to do something different, an alternative behavior that maybe they're not used to, maybe they haven't done before. And by the way, the behaviors that they engaged in previously are not working. So sometimes we see what's called an extinction burst, which is an increase, usually a rapid increase in those same disruptive or challenging behaviors that we don't want to see because they're not working. And when that happens, oh, by the way, we also see what's called response variation, which is new behaviors. So Johnny is no longer hitting himself in the head because he's realized it's not working, but now instead he's pinching you or he's biting his hand. So in those situations, where we have an increase in behavior, we have to be really careful that we don't go back to reinforcing that problem behavior. However, in many situations, kids and adults find the communication option to be much simpler. There's less response effort in touching a card than there is in hitting yourself in the head. So they oftentimes go to those communication options without even showing problem behavior. In fact, we oftentimes will see that we have lots of problem behavior in our assessment, and then we go to FCT and we get zero behavior from the very start. Now, somebody might say, well, that's perfect, right? We don't want problem behavior. We want it to stop. That's true. However, we've got a lot of research showing that we kind of want kids to test out their challenging behavior again because we want them to learn it just doesn't work. So if a kid learns to use a picture card and right off the bat they're touching the card or handing over, whatever we're asking them to do, and they're finding it successful, we do want at some point for them to also test out their challenging behavior again to see it doesn't work either. It doesn't work the same as the picture card. So when we do see those rises and increase, or those rises or increase in behavior, we have to be really patient, and we have to make sure that we don't reinforce that. But also, those are learning trials too, and those are really good for a child to learn. Oh, I threw a block at you and you didn't respond. It's not effective. And sometimes those bursts that I talked about can occur for quite a while, and sometimes they can come back too. One of the challenges, one of the colleagues that I'm working with here, Kelly Shields, and I, we've got a study that is looking at what happens when those communication options are not available anymore. So, if you have a device and the child's learning to use it to get what they want, and the device battery, the battery dies on that device, how do we ensure that they don't go right back to problem behavior? Because most kids do if they don't have that option. Their first thought is, I'll go back to the problem behaviors. So one of the things that we're trying to do is teach kids how to still tolerate those things they don't like, even when their communication options aren't working. And that's a lot of research going on right now on that.
Oh gosh, we're having great questions. So, is FCT being studied with adult individuals as well? And have we seen evidence of this helping nonverbal adult autistic individuals?
Yeah, that's a great question. It is. It absolutely is. It tends to be studied more at least in adults, more severely affected adults, a lot more in adults who are non-vocal, nonverbal. However, we have had cases even in our day treatment clinic where we've seen adults who we were previously told could not communicate, and we showed that sure enough they can communicate. It may not be vocally, but they can communicate with a switch. We had I think the oldest excuse me, patient that we did FCT with was 63 years old, and he had a lot of inappropriate social behavior. He would go up and touch people's faces as a way to get their attention. He was in a group home, and the group home said, you know what? He doesn't know how to get people's attention. This is his way of doing it. He can't communicate. And we real easily taught him to touch a switch that said, play with me, or I can't remember what the message was. And when we introduced that, he allocated all of his behavior to that. He stopped touching people's faces, and he only used that switch when he wanted their attention. So even with a 63-year-old adult, this is an effective approach. And by the way, it's not just effective with individuals with challenging behavior. This is also something we need to teach all children and adults who do struggle to communicate. Sometimes we need to just put them in situations where their communication is meaningful and it matters, and we need to prompt them to use that, and then we need to reinforce them when they do.
Okay, great. So, do you have a list of providers that do FCT that we could refer families to? And then the second part of the question is, she was wondering if this is FCT better for a specific age group? Would this be used in combination with PCIT, or does PCIT use FCT? Three questions in one.
Yeah, no, it's a good question. First, I mean, I think in most cases, FCT is pretty compatible with most other approaches and treatments. I mean, I would hope that most other approaches to challenging behavior are not going to be reinforcing problem behavior or providing the reinforcers for challenge behavior. So hopefully it's compatible in that sense. With PCIT, I think it absolutely could be compatible. Remember, this is for individuals who are struggling to communicate, not because they can't communicate, because in some cases we have kids who, like I said, will talk your ear off, but they just don't know when or how to do it. But it's a matter of giving them this option to communicate and teaching them when to use it. So PCIT, I mean, it certainly could be used within that. A child initiates with the parent and the parent responds and praises them. I think that's certainly something that we see. Going back to the question about providers, frankly, I think everybody should be able to both use FCT and to train and teach others to use FCT. I've seen speech and language pathologists who do a great job of this. There are a lot of behavior analysts who do this. In fact, this comes from the behavior analysis literature. I've seen folks, teachers. I've seen therapists of all kinds of different areas of focus do this, but primarily you're going to be looking at behavioral psychologists, applied behavior analysts, speech and language pathologists. Those are the people who are primarily going to be knowledgeable and trained in this area. But if you're a parent who has a child with disruptive behavior, you can treat yourself. You can train yourself. It's not something that has to come from a provider. It simply is helpful to have somebody help guide you through the steps. For those who want to learn more about FCT, there are a lot of articles out there. There are a lot of book chapters, and there's videos on it too. And I think even with the Child Health Specialty Clinics, you guys have been working on some videos that I think are going to highlight FCT and show parents kind of how to use it in a very simplified fashion.
Okay, great, thank you. Excuse me. How long do you wait while seeing a decrease in behaviors before you start training delays?
Yeah, I would say until that behavior is at or near zero. That's a great question, because we want the child to be proficient in using their communication option and also have allocated almost 100%, almost exclusively to just using that communication option. So if that means, and by the way, we only talked about using communication for kind of one function or one thing. Remember, there are infinite number of picture cards for all kinds of different snacks, all kinds of different electronics and things like that. So you could stick with FCT, with that immediate FCT reinforcement, where you don't even work on delays, but doing it for lots and lots of different things first, if that's what you want. The goal is just to get the kid focused on their instincts being to communicate appropriately first, rather than problem behavior. But before you move on to delays, you really do want that behavior to be reliably low in these practice sessions, and communication high. Oh, the other thing is you want the child to be independent with their requests. If you're always prompting your child, I didn't talk about this in the talk, but there are strategies to kind of help a child who's prompt dependent. Prompt dependent meaning that they wait until you tell them to communicate every time. That's not good. We want children to be spontaneous and independent with it. So until a child is independent, spontaneous with the communication, and behavior is low, I wouldn't move on to those delays.
Okay, and and what do you suggest to do as a reactive strategy when FCT causes an increase in behaviors upon initially implementing it?
Yeah, good question. So if that challenging behavior bumps up right away when you first start doing it, part of it is going to be waiting it out, kind of riding this wave that's not going to be fun. But I want you to find the very first, and by the way, I mentioned we don't want to prompt the child to use communication when they're showing disruptive behavior. I should say sometimes early in treatment, we will still do that. We're trying to teach that child what, to look for that communication. But what you're going to do if a child, instead of using the communication option, is showing disruptive behavior, I want you to wait until you have a short buffer of 10, 15, 20 seconds of no behavior. So the child calms down, even for 10, 15, 20 seconds, and then prompt them to use it. For children who show lots of disruptive behavior, it's going to be a massive, extinction burst. I would recommend we do hand over hand if it's a device initially. In other words, we restrict the item and we take their hand and touch it simultaneously so that they learn that they're getting that thing. Because sometimes it's just the learning process of I use this tool, I get what I want. And so sometimes just using hand over hand will prevent that extinction burst that we sometimes see. If it's vocal communication, and they're not using vocal communication or vocal verbal communication effectively, we may need to tell them what to say. Okay, I've got your iPad. If you want it back, just say play please, or say iPad, or whatever it is. Because in some cases, the individual may be able to communicate, but they don't know what the words are to communicate for what they want. And so sometimes we actually give that to them initially. But like everything, over time, we want to fade any of those prompts. We want them to use it spontaneously. We want them to come up and say, iPad, please, without us having to prompt them.
Great. So we got 2 questions left, so we'll try to get through them. Do parents need to be referred and evaluated prior to gaining access to FTC support and training?
Not necessarily. I mean, I think if a child is a good candidate for FCT, and really I think all people are good candidates for FCT, to be honest with you, it's kind of the base treatment for many of our kiddos. Then if they come in to see, like if they were to come to the University of Iowa, we have a number of people who might recommend that. Behavioral psychologists, behavior analysts, even psychologists who are maybe not strictly behavioral, they may recommend using functional communication training and help you get started on it. It doesn't necessarily take a referring provider if you have a child with challenging behavior to be seen by one of the clinics here. For kids who are out in the community and they want to see a speech language pathologist or behavior analyst out in the community, I would recommend, if they're really interested in FCT, that they reach out and find out how familiar that those individuals are with FCT, and can they help you get started on those.
Okay. And our final question today, is there a complete formal training on FCT?
Another good question, and no, there is not. There is no certification. And frankly, I'm glad there isn't. I want this to be as open to everybody. I hope for parents who, or even teachers or therapists who can learn about FCT and do it on their own, that they do that. You don't have to be certified to be able to do FCT with someone. There's no proprietary rights on it. Nobody would say don't do FCT if you've never been trained. They would say learn about it and do it. And frankly, the best therapists that we have are the parents. The best therapists that we see are the teachers. These are people who maybe don't have a long history of training in this, but we teach them and they do fantastic with it. It's straightforward, like I said, but not simple.
Okay, great. And we're just nearly out of time. I want to thank you for answering all those questions. That was awesome. We had so many questions. And I just want to remind the attendees that there is a handout in the handout section on how to attain your CMEs or CEs, but you will also get that same directive in an email tomorrow. So again, thank you, Matt. Really appreciate your time and expertise today. And I think we had a great learning session today. Thank you.
Thank you.
Bye, everyone.